Welcome to Certified Professional in Healthcare Information and Management System Exams CPHIMS Exam Preparation video. I assume you have already background information about this exam, so going to jump directly to CPHIMS exam content. CPHIMS exam is categorized into three broad sections. Let's see what. General, System and Administration. First we'll explore general section. General section is further divided into two subsections: healthcare environment and technology environment. Okay. Under the healthcare environment section, we are required to study following topics based on CPHIMS candidate book effective from April 2017. We are required to study articulate characteristics and services of different types of healthcare organization. For example, hospitals, clinics, ambulatory center, community health organization, healthcare payer, regulator, research and academic. Articulate characteristics of interrelationship within and across healthcare organization. For example, healthcare information exchange, public, private, continuity of care. Differentiate the role and responsibility of healthcare information and management system professional within the organizational structure in which they work, and describe role of government, regulatory, professional and accreditation agencies related to healthcare and their impact on clinical outcome and financial performance. Okay, now we'll explore each topic one by one. Okay, we will study this first topic: articulate characteristics and services of different types of healthcare organization. Let us take a deeper look at each of the topic one by one. Okay. Classification of hospital, outpatient or ambulatory care, community health organization, diagnostic and pharmaceutical services, also known as ancillary services, healthcare payer, healthcare regulators, and research and academic. These are different types of healthcare organizations. Let's see how hospitals are classified. Okay. How we can classify the hospital? So hospital can be classified based on ownership. Hospital can be public or private hospital. Public means government managed. It operates at national, provincial, state or other level. And private hospital can be for profit, tax, and can be not for profit, for tax exempt. Hospital can be classified based on level of care it's provide, like primary, secondary and tertiary hospital. Primary care hospital means essential care. Most of us are very familiar with primary care. This is our first and most generalized stop for symptoms and medical concern. We will see the secondary care, like a specialist hospital. When your primary care provider refers to a specialist, you are then in secondary care. Secondary care simply means you will be taken care of by someone who has more specific expertise in what is ailing you. And tertiary care, like hospitalization. Once a patient is hospitalized and needs a high level of specialty care within hospital, he may be referred to a tertiary care. Tertiary care requires highly specialized equipment and expertise. Okay. Hospital can be classified based on geographical location. It can be urban hospital, rural hospital. Rural hospital can be designed to offer critical access hospital and metropolitan statistical area hospital. Okay. Hospital can be classified based on type of services offered. Okay. Community or general hospitals or specialty hospital. Okay. Specialty hospitals like heart specialists, orthopedic hospitals. Okay. Hospitals can be classified based on area of specialization, like rehabilitation center, children's hospital, long-term acute care, heart, cardiac, behavioral health, specialty surgery, orthopedic, spine or neurology as example. Okay. Hospital can be classified based on duration of care. Short-term care hospital usually have an average length of stay of a few days, and long-term care hospital have an average length of stays of 30 days or longer. Hospital can be also classified based on teaching status. Teaching. Okay, teaching status. In addition to providing inpatient clinical services, teaching hospital train future physician and other healthcare providers, often associated with academic institution. Okay, teaching hospital may be further classified as academic medical center. Academic medical center, a healthcare facility that is often linked to medical school and or university complex and closely affiliated with or part of degree granting universities. An university hospital provide clinical education and training to future and current doctors, nurses, and other health professionals in addition to delivering medical care to patients. Okay, now we'll see the next topic. Okay, ambulatory or outpatient or ambulatory care. Okay, single independent provider offices and larger multi-provider group practice in which a broad range of specialists may be available. Ambulatory care or outpatient care is medical care provided on an outpatient basis, including diagnosis, observation, consultation, treatment, intervention, and rehabilitation services. It can be further classified as, we have already seen it. Let's go and see it again. Okay, sorry. Single independent provider office and larger multi-provider group practice in which broader range of specialists may be available. Now we'll see the next topic, that is community health organizations. Okay. Community health organizations tend to focus on geographical areas. Okay. Healthcare organizations serving the population of local areas tend to be broadly referred as community health organization. In the healthcare environment, a community is generally referred to a specific geographic location in which healthcare is delivered. Now we'll see the next topic. Diagnostic and pharmaceutical services, also known as ancillary services. Okay. Key services provided in this area include laboratory, anatomic and anatomical pathology services, diagnostic, imaging, radiology services, and pharmacies. Now we'll see the next. Healthcare payer. Payer in healthcare generally refers to entities other than the patient that finance or reimburse the cost of health services. Okay, it can be government finance and managed program. Okay, funded through country's general taxes. Insurance program administered by private entities, funded by employer, citizens themselves, or combination of both, and personal fund. Healthcare services are often personally funded by individual. Okay. Let's see the Medicare. It's a government Medicare, Medicaid, and CHIP, Children Health Insurance Program, is U.S. government funded program. It's okay. Medicare, through which citizens 65 years of age and older have most of their healthcare needs provided. Medicare, Fair Caste Federal State Program, support care for low-income families, and Children Health Insurance Program, CHIP, provides care to children of uninsured families that don't qualify for Medicaid, and several other smaller group of special population. Okay. In the United States, under insurance program administered by private entities, in United States, roughly 55% of citizens have employer-based insurance, and additional 10% purchase insurance directly. Okay. Personal fund we have already covered. Now we'll go to the next. Healthcare regulator. The healthcare regulator agencies ensure, monitor practitioners and facilities, provide information about industry changes, promote safety, and ensure legal compliance and quality services. Now let's go to the next. Research and academic. Okay. A role of research and academic is to support research and administration of universities, academic medical center, hospital, physician groups, other research, and publish much of the knowledge that advance the science of medicine. Now I'll go to the next topic. Now we have good ideas about organization involved in healthcare delivery. Now we'll explore interrelationship among healthcare organizations. The purpose of interrelationship among healthcare organizations are numerous. Some of the key requirements include, let us see what are the key requirements. These are the key requirements: enabling access to comprehensive care services, assuring effective transfer of care, ensuring general portability of care, reporting public and population health information, often referred secondary use of health information, obtain appropriate reimbursement for quality care, and supporting particular organizational model of care. Let us explore each key requirement little deeper. Enabling access to comprehensive care services. Health organizations are depend upon a number of partners within or outside of their organization to enable the delivery of comprehensive care. Providers in outpatient setting often rely on external laboratory and radiology services to ensure accurate diagnosis and on the availability of pharmacists to provide prescribed medication to complete the provider's care plan for patients. Now let's see the next requirement. Assuring effective transfer of care. To facilitate the provision of essential health information during transfer of care between provider or facilities, an initiative in United States encouraged the use of HL7, Health Level 7 International. HL7 consolidated clinical document architecture, which is a standard for electronically transmitting continuity of care information. Okay. Health Level 7, HL7 refer to a set of international standards for transfer of clinical and administrative data between software applications used by various healthcare providers. Okay, let's see. So, the HL7 clinical document architecture is a document markup standard that specifies the structure and semantic of clinical document for the purpose of exchange and consolidated CDA. The HL7 Consolidated CDA is an implementation guide which specifies a library of template and prescribe their usage for a set of specific document types. And memorize this for medication. What is medication reconciliation? For exam point of view, what is its definition? Medication reconciliation defined as the process of identifying the most accurate list of all medication that patient is taking, including name, dosage, frequency, and route, by comparing the medical record by an external list of medication obtained from a patient, hospital, or other providers. Now let's go back to the next requirement. Reporting public and reporting public and population health information, often refer secondary use of health information. Okay. So electronic health record (EHR) can improve public and population health outcome by efficiently collecting data in a format that can be shared across multiple healthcare organizations and leveraged for quality improvement and prevention activities. EHR can improve public health reporting and surveillance by making it easier for organizations to collect standardized systematic data. EHR will improve reporting capabilities. Okay, expand communication between healthcare providers and public health officials. Okay, and to better your organization's ability to prevent disease. With electronic health information about entire population of patients, you can look more meaningfully at the needs of patients and offer better health care. EHRs can remind providers of when patients need immunization, enable providers to send reminders to patients for preventive follow-up care, and give providers access to clinical protocol. Okay. The U.S. Center for Disease and Control Prevention (CDC) has been receiving health information from across the country for many years, not only to support such public health activities as actively responding to disease outbreak, but also to work proactively through education on prevention and healthy lifestyle through its division of population health. The United Kingdom Secondary Use Services (SUS) through its HSCIC program leverages the Secondly, use services in support of public health research and management, among other activities. Now go to the next requirement. Obtaining appropriate reimbursement for quality care. Healthcare providers are paid by insurance or government payers through a system of reimbursement. They provide medical services to patients and then file for reimbursement for those services with insurance company or government agencies. Name of some organization involved in payment system, like National Health Insurance (NHI) Canada, public finance and private providers; National Health System (NHS) Britain, government managed infrastructure; and public-private US, including Medicare and Medicaid. These are some organizations involved in financing of healthcare services. Now we'll see the next topic. Now we'll see roles and responsibility of healthcare information management system professionals. Here are a list of some key positions work in healthcare information management system: Chief Information Officer, Chief Security Officer, Chief Technology Officer, Chief Medical Information Officer or Chief Health Information Officer. They have the same responsibility. Chief Nursing Informatics Officers, and we'll explore other executive roles and responsibilities for healthcare services organization. Let us see Chief Informatics Officers, Chief Information Officers. What is role? Oversees all health management information system application, technology, procurement, acceptance, adoption, practice throughout the healthcare services organization. Responsible for what is the Chief Information Officers? Oversees all health management information system application, technology, procurement, acceptance, and adoption practice throughout the healthcare services organization. Responsible for alignment of corporate and CAHIMS strategic goals and objectives, including use of IT to improve administrative efficiencies and clinical productivity and effectiveness. Structure is Chief Information Officer. Can see application development support, data center operation, database administrator, desktop support, information security, and network operation. And a specific role an IT department may expect to fill. Desktop support technician, database administrator, programmer, application developer, web developer, network engineer, analyst, system analyst, administrator, project manager, and security analyst. Let's see the other position. Chief Security Officers endeavors to secure health organization computing communication access from other intentional or unintentional security breaches from inside or outside the organizations. Chief Technology Officer's role. Generally responsible for technical architecture of IT system, supporting the organization, and often look toward the developing market in HIM and IT to try and keep the organization competitive from technology perspective. Chief Medical Information Officer, Chief Health Information Officer essentially serve as the bridge between medical and IT department at a healthcare organization. And Chief Nursing Informatics Officers make sure effective integration of clinical insights into systems. Let's explore other executive roles and responsibility for healthcare services organization. Chief Executive Officer. Chief Executive Officer articulate Corporate vision, mission, and strategy. Chair senior executive meeting and conduct performance evaluation of top management personnel. Oversees corporate growth and development and ensure realization of a strategic business goal and objective or time. Let's see the role of chief financial officers. Oversees the financing of function, budgeting and funding of health services organizations operating program and services, including advising the CEO and other senior executive on its strategic capital investment decision, capital expansion project, market competition, and organizational revenue generation strategy. Okay. Let's see the chief operation officer. Oversees the daily healthcare service delivery operation, businesses, process, policies, and procedure of health services organizations care delivery, including advising the CEO and other senior executives on strategic business process reengineering, human resource development and productivity improvement project, operational and clinical efficiency and effectiveness enhancement project, scheduling, facility and inventory management, logistic and change in daily organizational production function. Chief marketing officer oversees the marketing and promotion operation, business processes, policies, and procedure of marketing and promoting the healthcare services organization care delivery, including advising the CEO and other senior executive on strategic marketing opportunities, purchasing and external relations projects, customer relation and satisfaction rating, and change in daily organizational marketing function. Let's see the other. Chief Medical Officer oversees decision and operation of physician and other clinical personnel providing services within the context of health services organizations. Now see the Chief Privacy Officers. Chief Privacy Officer oversees the ethical and legal dimension of organization information usage and release, set policies, standard and procedure for privacy and confidentiality of information release in compliance with HIPAA rules and standard. HIPAA stands for Health Insurance Portability and Accountability Act. Now we will see the next. Chief Knowledge Officer oversees the gathering, maintenance, and dissemination of health organization knowledge, design the organizational program and system to ease reuse of knowledge among organizational employees with aim of creating a knowledge-enabled organizations. Okay, now we'll see the next topic. Now we'll see our last topic, roles of government, regulatory, professional, and accreditation agencies in healthcare. Okay. See, government can play a following role in healthcare organization: purchase healthcare, provide healthcare, ensure access to quality care for vulnerable population, regulate healthcare markets, support acquisition of new knowledge, develop and evaluate health technologies and practice, monitor healthcare quality, inform healthcare decision maker, develop healthcare workforce, convene stakeholders from across the healthcare system. Okay. Healthcare regulators. Healthcare regulatory agencies serve a broad range of functions in healthcare environment. Remember, private sector, organization, commission and association may perform in regulatory capability as well. Okay. See. Okay. In the United Kingdom, Health and Care Professional Council (FCPC) is the statutory regulatory of more than 300,000 healthcare professionals in the country. FCPC maintains standard of proficiency and conduct for profession it regulates. In the United States, the dominating regulatory entity is CMS. CMS drafts the rules and finalizes the regulation for the management of multiple federally subsidized healthcare programs for the nation through a complex process of rule making involving public engagement. Okay. The Food and Drug Administration in the United States evaluate and approve medical devices and new drugs used in treatment of patients. Medical devices in Canada are regulated by Health Canada's Therapeutic Product Directorate. Now see the professional association. Professional association can be professional bodies and regulatory bodies. Under professional bodies, Their responsibilities include set and assess professional examination, provide support of continuing professional development through learning opportunities and tools for recording planning, publish professional journal and magazine, provide network for professionals to meet and discuss their field of expertise, issue code of conduct to guide professional behavior, and deal with complaint against professional and implement disciplinary procedures. And under regulatory bodies, primary activity is to protect the public health under regulatory bodies. Okay. Now I'll see the accreditation organization. Okay. Accreditation organizations play a similarity role in that they often serve on behalf of federal organizations to ensure a specific standard or condition of participants are met, COP are met. So some CMS approved accreditation organizations are Joint Commission, JC, Joint Commission International. Okay, what they can do? What is program type for Joint Commission? It can accredit Ambulatory Surgical Center, ASCS, Critical Access Hospital, CAH, Home Health Agencies, HHAF, hospitals and psychiatric hospital. And another CMS approved organization is Accreditation Association for Ambulatory Healthcare, AAASC. It can accredit Ambulatory Surgical Center, ACS, and Accreditation Commission for Healthcare, ACSC, program type. It can accredit Home Health Agencies, HHAS, and hospices. Okay, so in this video I have covered healthcare environment. Okay, I have covered this healthcare environment. In next chapter I will cover technology environment. Please comment your suggestion for improvement. Thanks for watching my video.